You see, everyone out there, you all really need to understand that it is not only when you have sexual intercourse that you are going to have a vaginal infection. You are all exposed to vaginal infection. You can have vaginal infection at any time. But the best for you is for you to recognize the type of vaginal infection you have so that you'll be able to know the treatable drugs that you can take. Hello, wonderful. You're welcome to our channel, Ask Nurse Malik. If you're just joining us today, make sure you subscribe, and if you've been with us, hit the like button. Today we are simply going to explain that number one vaginal infection that have been troubling a lot of women out there, and at the end of the day they keep on treating without letting go. What is this vaginal infection? It is called bacterial vaginosis. You see, women that are with bacterial vaginosis, this is the most difficult vaginal infection that they have been battling with. Although there are still other vaginal infections, but this one is sometimes it can be irresistible. It can keep on reoccurring and give you a lot of problem, a lot of symptoms, and a lot of signs. The most funny thing is, all vaginal infection have similar signs and symptoms that they are going to give you. But it is best when you know the specific or the unique sign and symptom of a vaginal infection, you'll be able to know how you are going to treat it. But in this case of bacterial vaginosis, what is bacterial vaginosis? It is a bacterial infection. It is a vaginal infection that is caused by any woman who is at risk of any sexually transmitted diseases, or anyone who have had sexual intercourse with a man or with a partner who is not screened, a man who has been infected with sexually transmitted diseases. You are at risk if you are the type of man that have sex with multiple partners, or you are a woman that your sex toys are not clean and you eventually insert them into your vagina. These are the things that can actually bring this bacterial vaginosis. Once you have this bacterial vaginosis, like I said, it is a bacterial infection. It disrupts your normal bacteria in your vagina. Every woman has the specific bacteria in their vagina that helps to maintain the normal health or the overall health of the vagina. It helps to keep the balance. It maintains the pH level of your vagina, and that is what actually makes it to not allow any other harmful bacteria to thrive in it. But in this case of vaginosis, there are a lot of bacteria that are already in your vagina aside your normal flora. So in this case, you are going to have a lot of problems. You are going to have a lot of signs and symptoms. That is when you begin to have itching in your vagina, or you see rashes, your vulva becomes swollen, and most importantly, you will have discharge. If you are the type of woman that you are always having discharge in your vagina, your pants will always wet. Sometimes it can even take you to change your pants 3 to 4 times in a day. This is bacterial vaginosis. They come with a lot of discharge, purulent discharge. This discharge will be grayish and thicky. This is as a result of bacterial vaginosis, and it is caused by bacterial infection. So once you know this, you will be able to differentiate this vaginosis from every other vaginal infection like vaginitis, trichomoniasis, human papillomavirus, and every other ones. So this bacterial vaginosis is treatable, and you can get it treated with the use of your antibiotics. If you are a woman and you've been using antibiotics for that vaginal infection and it doesn't go, probably those antibiotics might not be sensitive to that vaginal problem. So you will have to do cultural sensitivity before you'll be able to know the exact antibiotic that will not be resisted by that bacteria in your vagina. So if you're a woman and you're experiencing such, you've been treating, buying drugs, a lot of drugs, we're recommending drugs for you, and it keeps recurring, I would advise you to go and get your high vaginal swab done. As you go to your health practitioner, they are going to tell you to do some certain tests so that you'll be able to know the kind of drug that infection will not resist, and you'll be giving some of those antibiotics and to clear off those infections. So it is best you know about your reproductive health so that it won't lead you to serious complications, because most of the women today, all of these vaginal infection is what has led them into infertility, has led them into endometriosis, and has led them into numerous conditions that they cannot even know how it come about. So get this awareness of this bacterial vaginosis. Share this information to every woman out there you know they have 1 or 2 of these vaginal infections, so that they can get themselves screened and get themselves treated, especially if it is for bacterial vaginosis. Like I said, there are numerous vaginal infections out there. It is only when you know the exact one you have that you'll be able to know the particular treatment or the exact medication that you can take to get rid out of your body. So stay healthy, improve your reproductive health. Always ask your question. Don't forget, you can always ask your question relating to your overall health, your sexual health, your reproductive health, anything. Write your question under the comment box and your answers will be given to you. Till we meet again in our next video. Here are some videos I recommend for you so that you'll be able to understand other reproductive health issues that you can help with from this video.